Hey guys, today's webinar is almost live, broadcasted from s.r.o headquarters in Jena, Germany. My name is Dr. Andrew Steps, and we will be talking today about this star, the MeDioStar. That means we will be talking about the largest handpiece in the market, we will be talking about the fastest handpiece in the market, but as well we will be mentioning hair removal, skin tightening, skin whitening, pigmented lesions, vascular lesions, acne, so a lot of different things. So wherever you are, thanks for joining in, thanks for watching, thanks for listening, and best regards out there in the world. Thanks for your interest. Let's get started now. So guys, this is it, our pretty baby, our curvy model. The latest of 5 generations MeDioStars, and black and white. Well, it's suited. On the front you have the user interface, all the emergency button, main switch, stuff like that. You do have, of course, the handle. You do have some storage for ultrasound gel, wipes, whatever. And you do have, alright, 2 different handpieces. So, for example, the largest one, 10 centimeters squared in here, with a lot of power, 5000 watts, and the fastest one, 1 centimeter squared and up to 20 hertz. I think this is pretty good for a hair removal device. How does it look? It's an s.r.o device, MeDioStar of s.r.o, and ta-ta, what do we have here? We have a wireless foot switch. A wireless foot switch, you all know this stories. It's bumpy in the treatment room because of all the wires down there. History. I think a pretty cool gadget. Let's get started right away and stay tuned. Here once more the handpieces. Then after switching on the device, you have a user interface which pops up with 3 different buttons. I was told that I should use, being a rookie, the button right in the center, which is called indication. So the device would tell me what is possible to do. So, and what is possible, what do we see here? So hair removal, we have rejuvenation. Rejuvenation is meant to be tightening or whitening. We do have vascular, acne, we have pigments and onychomycosis. So let's start with hair removal first. After pressing, you have a first field in here which is called monolith. The monolith is nothing else than the brand of the handpiece. So there are no handpieces anymore, there are just only monoliths. And this is the largest monolith, this is the XL. We are talking about 10 centimeters squared in here. This is the monolith S for small, with 1 centimeter squared. This is considered to be one of the largest, and if not the largest on this planet. And this is considered to be the fastest in this planet. 20 hertz is possible. We will touch that topic later on. So after going into this indication button and epilation, we are in need for choosing different handpieces. Then we are choosing different areas and skin types. There are always popping questions up about the skin type matter. Skin types between 1, 2, 3, 4, 5 and 6. Easy thing. For once and all, what about the skin types? 4 little questions. What about the skin color, hair color, color of the eyes, and the time in which you would get a sunburn without using a sun blocker? That means skin type 1 would be red hair, blue or green eyes, some sun freckles, sunspots, and you barely get tanned anyway. Skin type 6 is exactly the opposite. It's all black hair, black skin, black eyes, and there is no risk of burning your skin at all. And everything else is in between. So I'm skin type 2. Let's consider I would be the guy to be treated. This would be my setting, skin type 2. The density, as you can see me, is not very high. And the thickness is a matter between vellus hair up to terminal hair. Vellus hair, mostly in females, of course. In males, we have very often thicker hair, and of course, you do have more. Approximately 70% of the male hair is terminal, while in the ladies 70% is approximately vellus hair. After pushing all that in here, you confirm, and you end up with some kind of recommendation with this handpiece with a certain level of fluence, and this correlates to a certain pulse duration. Here we have the speed and the shape. What does the shape mean? You do have two different options, single or double pulse. Of course, you can alter different pulse durations up to you. And that means let's get the thing started. Well guys, we are ready to go, almost. Some little preparations are still pending. Preparations which are unique to this particular model. There is something called Easy Clean. Easy Clean is something like a foil, and this foil is to be connected to the laser itself, to the window. You see there is something like glue behind. You can just cover it like this in order to avoid any kind of cross infections. As you can see, a little white pen will do. Why? Because white is reflecting all the laser light and will help to protect any benign pigmented lesion. My request or my recommendation would be anyway to check very, very closely which area you're gonna treat. Here you can see the preparation for all those nevi, any kind of benign pigmented lesion. Anything else is contraindicated anyway. Besides that, any kind of inflammation, active inflammation, non-benign pigmented lesion is of course contraindicated as well. Some cases of diabetes because of polyneuropathy, and therefore please watch out for a proper made patient's consent. A photo documentation is needed before and after. And let's get started now. The client is ready, we would be ready as well. Let's find the proper setting for her. Indication, epilation, body XL, skin type 2, density is low, thickness is low as well, and this is our recommendation. Push the button and we are on the fly. The wireless foot switch is in here, very convenient. I like this thing. Let's go. Here we go. 3, 2, 1. Short feedback of the patient if everything is ready, and now it's time to adjust, to modify if everything is fine, we can just continue, maybe increase the speed a little or lower the fluence depending on what she likes. After setting everything up, this speed in this size is really incredible. We are easily sliding. A little bit of chill is always needed. I do maintain a good contact. And half of the leg is already finished. You might have taken the time, it was less than a minute. Let's continue even faster. Just to let you know why we needed exactly that, the program or the mode we were using is the so-called static mode. That means it's the old school hair removal. We were using 2 Hz at an average fluence with a short time. Even though this is pain-free, we have a softer mode available, and this mode is called dynamic. And dynamic mode means you have a lot of sublethal impulses stacking, accumulating to a lethal dose. Here we have a lethal dose with just only 1 shot. That's why static. Each area 1 shot. That's it. That's the treatment. With the dynamic mode, we will be sliding, and I will be showing this on the next leg. So you can see here we have changed the mode to the dynamic. We decreased the fluence, we increased the speed. The time is at 15, which is pretty short, and the mode and the way to treat is a little different. So that's what I would like to show you here. So we have to pass several times. That means the fairest way and the easiest way is just to, here we go, little pressure. 1, 2, 3, 4. Of course, no one would do like that. That means maintain always a good contact, and here we go, sliding. 1, 2, 3, 4. The faster you go, the more painless it gets, because there are only a few impulses in a certain area. So to maintain a proper treatment, it's about this speed. 1, 2, 3, 4. And here we go, once again. 1, 2, 3, 4. 1, 2, 3, 4. Next area. 1, 2, 3, 4. 1, 2, 3, 4. 4 is a minimum, and you might increase the number of passes by lower skin types. Higher skin types, less passes. Lower skin type, more passes. Well, this handpiece is equipped with a diode which emits approximately 5000 watts, which is more than enough. The wavelength is a mixture between 800 nanometers and 940. And the same applies to the monolith S, which is to be shown right away. The same wavelength in the XL you can find in the S as well, here a mixture of 800 nanometers and 940. Why 940? 800 I think is well established and no need to talk about that. And 940 is well absorbed in hemoglobin. And hemoglobin is actually the chromophore which supplies the follicle. That means the idea is you have a longer wavelength, a more penetration, and a high absorption in hemoglobin in order to cut the feeding vessel. This is the idea. And the other moment is, of course, you can treat with a longer wavelength, of course, much higher skin types without any problem. The next problem, or the next matter, is in treating higher skin types, the cooling. It's not only about a good laser and powerful laser. If you have a powerful laser, you are need desperately for a powerful cooling as well. That means here we have a 360 degrees cooling, and of course the sapphire is cooled as well. The same applies here, 360 degrees within something like a cool pad just below the sapphire of the laser. 1 centimeter squared, 10 centimeters squared. Up to 20 Hertz, up to 5 Hertz. Well, and the same what I showed you before with the Easy Clean, same size. You can of course attach to any of the monoliths. Just like that, and we are ready to go to treat the other leg with the monolith as well. So compared to the monolith XL, the S is pretty small for areas, for example, axilla, bikini line, in the face, but as well due to the fact that it's very fast, you can treat larger areas kind of really good. Here we go. Or instead of circular motion, you can go for linear motion as well. 1, 2, 3, 4, 5. Once again, 1, 2, 3, 4, 5. Once more. Very easy to handle, easy to follow in all radial shapes, like for example the legs or the arms. I would recommend to go for linear motion instead of those circular, because of the coverage. The most important thing is it's a direct laser, an in-contact laser, maintain contact in order to get the most of the laser light into the skin. You might ask why diet? Because, for example, other lasers with other wavelengths will be mirrored, reflected on the surface of the light, on the surface of the skin by up to 60%. So we are making sure that having the handpiece in contact to the skin, we are dropping the light right there where it's needed, and that's where the follicle is. Once more, easy treatment. Here we go. 1, 2, 3, 4, and 5. Once more, the passes are about the skin type. Lower skin type, more passes. That's the speed in the leg. Let's see what an axilla does with that kind of thing. The dynamic mode with the small one is made for the body and, let's say, a little bit more smaller, thinner area, such as the axilla. Let's see how it does, what it does in here. Once more, I have applied a little bit of gel, only a thin layer. Whatever kind of monolith you're using, the S, the M, the L, the XL, or the Alexandrite, we are all in need for a little gel, just only to slide it over the across the skin and to catch the light, to lead the light into the skin. You maintain always a little pressure, good contact or a little pressure, and then let's go ahead. 1, 2, 3, 4, 5. 1, 2, 3, 4. Okay, it's kind of tricky, really simple, really fast, and as you can see, literally pain-free for the client. And you see as well, the way of my motion is always recoil first, shoot later. What I would like to recommend is to move always downwards or to pull always the handpiece. Why? Because the largest zone of pre-cooling you have just next to the laser window. That means the better you pre-cool, the more efficient you pre-cool, the safer is your treatment, and because the patient doesn't feel anything, you can apply a little bit more fluence. That means as well more efficient, safer and more efficient in the very same moment. The way to move the handpiece is pulling like this with a slight contact. Please take a closer look here. Don't move like this. Maintain a good contact, a proper contact, always with the pre-cooling and the laser. Good contact, a little pressure. That's it, that's the wisdom. Well, there are much more things to do than just only hair removal with the Monolith S. So, for example, rejuvenation, whitening. There is a preset coming up with 25 at 150 joule. My recommendation is to lower down in a correlation between 10 to 100, 15 at 150 milliseconds, and double or single, depends on you. This is a way to heaten slowly up the skin, very gently. Another option is what I would like to show you, the so-called white and tight. The white and tight mode is a mode which comes up with a very low fluence but very short pulse at a higher repetition rate. We are talking about 5 joules at 15 hertz. 5 joules at 15 hertz. It's a little bit off record, so to say. We are treating as well off contact, and this is always a little bit hard to teach and hard, let's say, to evaluate, but this hang loose as a proper distance, so 15 centimeters. So 5 joules, 15 hertz, 15 centimeters, and an area which is 10 by 15 centimeters is to be treated approximately 1 to 2 minutes. So you can maintain in good contact to the client. Here we go, 3 to 1, and we start shooting. My recommendation is always to use something like an infrared thermometer, or you do have an infrared camera in imaging system about the heat. So what happens actually is, with a very short pulse, you're treating the epidermal melanin, and you are step by step planching the skin. But by the really high amount of stackings or of pulses, you are going for a nice warming up the skin up to the dermis in order to get or to trigger a neocollagenesis. So consider 5 joules and 15 hertz is 75 joules in 1 second, 60 seconds or 120 seconds, and you have a lot of energy put into the skin. And energy is equivalent to warmth or to heat, and heat is equivalent to damage, and damage is equivalent to recuperation or to adaptation. That means the more damage you are doing, and we are talking about in reversible thermal damage, and approximately in temperature level of 40 to 45 degrees, a little bit more, but we are not coagulating, it's in reversible thermal damage, you can get a nice tightening effect. Very easy, you see that. Besides hair removal and skin whitening, skin tightening, there is another handpiece and there is another application. There is vascular handpiece. This is how it looks like. You do have the cooling tip in here. You do have the laser tip over there. It's a round shaped spot, but there's an active rectangle 3 by 4 mm, and it's pretty good for telangiectasias, angiomas, hemangiomas, port wine stains, or so for example leg veins. And this is what we are doing here now. We prepare everything, patient's consent, photo documentation. You can cool a little bit. You should not worry, especially in telangiectasias or hemangioma, for vasoconstriction, due to the fact that it will not constrict so much. In telangiectasia might be different. It's okay to use for something like 2 to 3 seconds just only the cooling tip. If you would like to be super safe, you can go for a cool pack, not an ice pack. So 4 to 8 degrees is the best in order to avoid any kind of freezing reactions on the skin. Hypothermia problems. What are we doing here? We are checking once more the skin type, the size, so the diameter of the vessel, and the device will come up with a recommendation. Let's go and see what it tells us for this kind of case. So we are going for indication, vascular, leg veins, proper skin type, let's say small and thin. This is in proper way to start up with. Those recommendations are always on the safe side. You might increase when, if you see a collapse of the vessel immediately after application of the laser, then you are on the safe side. This is the clinical ending point you would like to see. If you watch very closely, you can see it might be that there is a little dark area which is coagulated hemoglobin, and this is where you spot next. For vessels which are deeper, you go for in perpendicular kind of handling. That means 90 degrees if you have deeper vessels, deeper indications, deeper locations. Otherwise, you go for something like 45 degrees, and you're always treating upstream. You are starting where the vessel goes to, where you barely can see it, and then you go upstream. Preparation. At first you go for a compression test. That means you check out about the bloodstream. So that means just only like this. This is the way the blood goes. The blood flows from here to there. Once again here. So it's quite easy. If this compression test is not enough, then just try to put it like that or like that. start in the very end where you can barely see the vessel. Start within 90 degrees and then work against the flow like 45 in this depth. I would like to show you that right away. Once more, please react on this video if you would like to have further informations, more treatments, more patients, more cases. Let us know. We are happy to serve you well. In this case, let's start with this patient. Let's start the treatment. First things first, and first things is cooling. We have applied some gel. We pre-cool the area first. Don't press too much. Pressure is compression on the vessel. So after pre-cooling, once again, deeper vessels 90 degrees, more superficial vessels 45 degrees. Come closer. Here we go. 3, 2, 1. 3, 2, 1. 3, 2, 1. It might be a little bit painful. 3, 2, 1. Here we go. And shot. Next one. Here we go. Shot. This was 90 degrees in this vessel. Then we go ahead. Pre-cooling. Always maintaining good contact to the patient. Here we go, 3, 2, 1. And 2 more, 3, 2, 1. And 3, 2, 1. Good contact, good cooling, maintains literally pain-free treatment. So after all, thanks for watching this little webinar. This should be just only in teasing webinar, and I would like to react gladly on your requests what you would like to see more. Once again, what we were talking about today was treatment of hair removal with the large handpiece with the so-called XL monolith. We were talking about treatment of backs, chests, and large areas like the legs. Just to have an orientation for a full body, you would need with this kind of handpiece less than 30 minutes. Full body means except the face, of course, and parts of the neck. We were talking about as well the monolith S, so the small one with 1 centimeter squared. This handpiece is good for all the rest, all the leftovers. So for small little fine lines in the axilla, in the bikini lines, in the labia majora, perineum. With this handpiece as well is able to be done skin whitening, skin tightening. We were just mentioning the treatment of active acne, which is as well possible to be done, and onychomycosis. Later on, we were talking about the vascular handpiece. The wavelength is 940 nanometers, and we were treating here leg veins. If you would like to see more indication, let us know. As you can see here, once more, it's one of its kind. So wherever you are in the world watching us, thanks for your time. Thanks for your patience, and thanks for your requests and questions. Let us know what you would like to have, what you would like to see, if you would like to get live in contact with us, taking part and having live treatments as well with you. Thanks for your interest wherever you are. Take care and bye-bye.